Good evening, I'm Earl Gibbs, and welcome to Earl Gibbs Live. We're coming to you live here from World Star Studios at Amsterdam Shopping Center. And with me this evening, I have the Inspector General of Health in Sint-Maarten, Dr. Best. How are you doing, Doctor?
I'm fine, Earl. Thank you for inviting me again to your show. It's a pleasure being here. Good evening, listeners and viewers.
And thank you for accepting the invitation. You was a hard-working man after Hurricane Irma, man.
Very busy, still busy.
Yeah. I guess people don't realize, let me go back a little bit. No, when you have a storm of Irma's magnitude, the average person doesn't know what's happening behind the scene.
Right.
And with Irma, you made sure that the population of Sint-Maarten got clean drinking water.
That's correct.
I don't think people realize how significant that was at the time when it happened.
Well, one of our primary tasks is to restore, say, the health sector and public health to prevent issues like disease outbreaks. So one of the key things in preventing that is making sure your population gets potable water. And that can be either by your production company, distribution company, or by distributing bottled water if necessary. And we did both. We did both actually. But as you know, GB got severely damaged in the network. All the tanks, 8 of the 14 tanks were pretty damaged actually, out of service. So we're still recovering with that. But we actually, after 7 weeks, we were able to route the water in such a way that most of the households could get potable water.
So at least there was never a problem with getting clean water to the people of Sint-Maarten?
No, we added chlorine, of course, just to prevent bacteria in the water, of course, because you don't know where the leaks are after the hurricane.
Right.
So we added chlorine to the water to make sure that it became potable. And we, of course, we sampled the water daily, on a daily basis, on different spots on the island to make sure that the chlorine level was okay.
That had to be quite a challenge at that time.
That was quite a challenge, and for sure, with all the other difficulties you had, transportation, getting staff to work, etc. But we managed to do that. Yeah.
What you learn from that experience?
The most important thing is, one, giving proper information to the community before, of course, the hurricane season, but also before a hurricane, having them stock enough water, giving them the right information and procedures on how to get potable water if they have, for example, a cistern. Yeah. Some people are going to drink the water from the cistern, but you should know that your cistern should be clean.
Right.
You should add chlorine in it in the proper manner. This type of information is very important to provide to the community.
Now that we've gone through that experience, there's a lot of people still with cisterns. You advise them to throw Clorox in the cistern water, or do it in pots?
Now, whoever has a cistern needs to keep 2 things in mind. You need to maintain your cistern. Okay. A lot of people don't maintain their cistern. You have to keep in mind the cistern is fed by water coming from the roof usually.
Yeah.
And there's dust on the roof, especially now in the dry season, there's a lot of dust. You can get leaves, you can get whatever you can get. Everything that's in the air and on the roof, you get in your cistern. You try to filter it out, but it will still end up in your cistern. And that will cause sludge in the cistern, creating algae growth in the cistern. So you will have to clean your cistern at least twice a year.
Really?
Really clean the cistern and make sure that there's a proper coating in the cistern, but also mark your cistern, the height of your cistern. So when you go and add chlorine in the cistern, that you know how much you have to add, dissolve in the cistern at a certain volume of your cistern to get the proper level of chlorine in your cistern. Otherwise, it is not effective. Okay. So maintaining your cisterns, make sure you have a proper coating in your cistern also is very important.
You know, when I was growing up, we used to have fish in the cistern. It's still advisable?
Fish, some people throw them in, like baby tilapias, for mosquitoes actually.
Right,
okay?
right.
For mosquito, the larvae of the mosquitoes, the fish eat those larvae. So you don't get mosquito breeding in the cistern. But if you add chlorine, that would be sufficient too. And I would advise, not many people do it, but I would advise to keep a certain chlorine level in the system. And especially if you haven't been using your system for a long time, it's very important.
And understand too that rainwater that's falling now is already contaminated.
I wouldn't say here. We don't have really heavy industry on the island. So the rain itself that comes down is not really contaminated. It's clean water. But water that goes from trees, from your roof, ending up in your system, that might be contaminated, yes.
Okay, so at least, but you surprised me when you said you have to maintain the system. I thought maybe every 5 years, but you said to us that's a lot. It's about
I can tell there are quite some hotels here that you know still have cisterns. Smaller hotels, big hotels, they all have cisterns. Private cisterns at houses, but people need to learn to maintain their system. It's very important, especially before the hurricane season. Make sure you clean your system. Now, a lot of systems have been constructed in such a way that's very difficult to maintain. They have a very small passage to go in.
Right.
So it becomes very difficult to maintain the system. So if you're going to construct a system, do it also in the proper manner.
So then you have to empty the system completely then?
Yes, you have to empty the system, scrub it, and actually clean it with a high pressure sprayer or add some chlorine water to and clean it completely. If you have to paint it, make sure you paint it properly too.
Wow, I can tell you right now.
And then you have to get the water out, of course.
I can tell you right now, doctor, many people in Smyrna have systems, they're not maintaining them.
No, what people do usually is the water that comes out of the system, they, of course, let it flow through a filter first. But that's also something you need to know to install the proper filter. You have filters with different passage. And if you want to filter only sediment, for example, you can buy the cheapest filter. But if you want to filter bacteria, you need the more expensive filters with the most smallest pores in them.
And in fact, that's what I use when I had to go to use my system water. I use those double chamber filters for bacteria and chlorine and everything.
Correct.
They did a perfect job. The water tastes very good.
Correct. No, that's true. But you have to also change the filters regularly. And some people have the filters right outdoor, catching sunlight all day.
Not good.
And that promotes algae growth in the filters. You know,
so after Hurricane Irma, what were some of the other challenges you had?
Well, I was primarily focusing on, as I said, making sure the community gets potable water, either through GB or by providing distributing bottles. The other task that we had was making sure that the health sector, meaning GPs, pharmacies, and the hospital, White Yellow Cross, elderly care, that they all get the assistance and help they needed to get up and running. The hospital and White Yellow Cross, big institutions, Mental Health Foundation, they had food, stock food, for example, up to a week, 10 days. Experience has taught us now that you should stock at least for 2-3 weeks. You know, because it becomes an issue. And the hospital, for example, had sent a lot of patients, discharged them before the hurricane. They went home or stayed over with family. So they didn't have many patients in, but the White Yellow Cross, of course, has elderly that you can just, send them home. So they were stocked pretty good. And they have, for example, their own water production unit, which they purify to reverse osmosis, groundwater that they suck up from the ground and purify it. So they had no problems with water, and they have a diesel generator. What the problem becomes then? The diesel.
Really?
They didn't. You can't really stock diesel, so the diesel supply becomes then an issue.
Okay.
And so you have to make sure through organizing it through the EUC, the Emergency Operations Center, that those, say, critical institutions are being provided with supplies, with diesel, everything they need. And this was the task, coordinating those things, making sure, going around, seeing what issues they have on a daily basis and see how you can facilitate them.
I know that the French side, the next day, the French government had military transport planes taking people from the hospital on French Mountain to Guadeloupe. I don't know what happened really on the Dutch side.
On the hospital on the French side, you mean?
Yeah, yeah. The French side did a pretty good job, no doubt about that. But when it came to our side with the hospital, I'm not aware what really happened there. If they had
The hospital, there were two main issues. The outpatient department had some cracks and leakage, water leakage, and the dialysis center also suffered some cracks. But more important, the dialysis center, we couldn't guarantee at that time in the first weeks that they would get water, enough pressure, and clean water.
So what did they?
So that's why the dialysis patients were evacuated to Aruba.
Oh, okay.
40 patients or so, they were all evacuated to Aruba. Just to make sure, because, I mean, if you have a dialysis patient, some patients would need to dialyze for 4 times a week, 3-4 times a week.
Right.
We wouldn't be able to do that here.
So they stayed in Aruba for...
They stayed in Aruba for about 6 weeks.
So those were the only patients that had to be taken out from the St. Martin Medical Center?
Yeah, and of course the acute patients that had to be flown out, which also happens out of the, out of the hurricane season. Yeah.
When it comes, let me ask this, doctor, because a lot of people I see now are stocking up on water, and bottled water comes in plastic containers. Should they be concerned about where they store them or where the store is keeping them? Because I understand if bottled water is kept in high temperature area, there's a lot of sunlight, it's a problem.
Yeah, the best thing is of course not to keep any bottled liquid in a place where there's a lot of light. Keep it in a cool, not air conditioned, but just cool, dry place, avoid direct sunlight on it. That's the best thing. And of course, water remains good pretty long. I mean, it can remain in a bottle for over a year. So that won't be the issue.
I know that for a lot of people, they saw some recalls of food items from mainly the U.S.
Right.
In the last year. I think there were 2 or 3 different recalls.
Correct. Well, coming back to Irma, I'll move on to the recalls in a few minutes. One of the other important things that we did is to prevent disease outbreak. You would survey all the mini markets, the big supermarkets, and make sure they're not selling spoiled food. You know, if you don't have a generator or your coolers are not cooling properly within a certain days, the food is going to spoil, especially meat. So we were supervising all the supermarkets, make sure they would discard all the spoiled food, perishables, everything. That means we would supervise the whole operation, discarding all the way to the dump, make sure that it's being destroyed. Just all to prevent disease and that people don't get food poisoning. The same with restaurants. The mini markets started opening when we gave the permissions, and the bigger ones also when we gave the permission.
Oh, so they couldn't open until they got the permission?
Until they got the permission from us, to make sure that they are okay. Okay. So coming back to the recalls, yes, we had a few recalls in the recent months. This year we had, I think, pharmaceutical also, but 3 for food products. Meaning that we get notification from the producer, the manufacturer, that there's a certain batch, a certain production batch that is not good for consumption, or it's suspect. And out of precaution, and of course because of also insurance claims, it is then advised to all the countries to get rid of the product and advise your consumers. So that is what we do with regard to food products, but also with regard to pharmaceuticals. We had 2 recalls on pharmaceuticals this year already.
I'm going to come back to that. I remember the last time you was on this program, there was a recall of beef from
Brazil,
right?
Correct.
And that everything went good.
That case, it was a big case because it was corned beef.
Right.
And apparently there were 7 production plants in Brazil where the quality control wasn't sufficient, or they neglected it. And what happened is that a specific batch of corned beef from different brands in Brazil were exported. And it became a whole scandal almost. Even in the States they had the corned beef. So those specific brands of corned beef and batches and production date and everything We had to warn the consumers, of course, and we had to talk with all the importers here. That is one of the most difficult things in St. Martin, because you want to talk with the official importers, but then you realize, hey, there's a lot of parallel import. You know, people that don't go through the official channels.
Just bringing their own products.
Bringing their own products, and then you need to find those people. So you have to go out and see wherever it is being sold. If we talk, for example, one of the biggest importers of food products is Prime.
Right.
Okay, so we would usually know, we contact Prime, we sit with their manager, and we discuss everything. But then Prime tell you, okay, we deliver there and there and there. But then you go out and you see it in elsewhere in other stores too. And then you ask, so how does it come in? But we know this is St. Martin, so stuff comes in either through small boats or it comes in through the French side, you don't know. So you have to go out in the field.
Makes it difficult.
It makes it very difficult and challenging.
Yeah, and I think that's why...
But that's why we also, immediately when we have a recall, we publish it so the consumers, the population is aware.
Yeah.
And they pay attention when they go shopping.
I noticed people really look out for those recalls, and they pay attention, because I know there was one recall, I can't remember, there was one with some Cheerios or something like that.
Yeah, that was cornflakes from Kellogg's. Yes.
And there was
the eggs, we had only the eggs too.
Let me tell you, the eggs was the biggest concern for a lot of people.
Yeah, you have eggs with salmonella. You don't want to get salmonella in your body.
But then again too, if you buy the eggs, right? I mean, you're a medical doctor, and you cook it. There's a certain temperature that will kill the salmonella, right?
You know, if you fry the egg or you cook it, yes. But what happens is, people would use it also for baking cake.
Okay.
And those things, and that's when you introduce the bacteria and you don't get sufficient heating and those things. So there's always a risk attached to consuming contaminated eggs. And this was also from a very specific farm.
Right.
It's one of the biggest one in the States, that a certain batch, production date, everything, we gave that information, of course, to the media. They were contaminated with salmonella. So
did you all confiscate a lot of eggs in St. Martin?
Yes. Oh, there, of course, you also go there to the importers and discuss it with them.
Yeah.
And they also will inform their clients.
So then, in a case like that, right, the supermarkets, they all make a note of how many dozen eggs they had like that.
Yes,
because
they can claim.
I'm sure, exactly. They don't want to lose money.
Yes.
Right.
We gave them a statement that they had to discard the eggs.
Yeah.
And they can claim it all. Yeah.
There was also one with, I think it was lettuce or something like that. Did that come?
Yes, that was the last one.
Yeah.
That was lettuce coming from a factory in Poland, if I'm not mistaken, if I recall properly, it was in Poland. And it's actually a supplier for processing facilities. So they buy it there, they process it, pack it, and sell it under their brand name. But everything that was coming from the factory, and that was a specific type of lettuce, was also contaminated. So we also had to get rid of those. Normally, we get the information either from the FDA in the States or the United States Department of Agriculture, USDA, or from Holland, the NVA, the commodities institution there that is supervising that. So we get warnings, and we also, of course, we read too. I mean, this goes very fast.
Yeah.
And we have a very good relationship with the United States Department of Agriculture, where they would feed us immediately if they know. And we can also verify stuff there with them.
What about the pharmaceuticals that you had in recall?
The pharmaceutical that was recently recalled, that was a anti-hypertension pharmaceutical, a drug for against hypertension. And apparently one of the chemical compounds in it that came from China was contaminated. The factory had a huge batch where there was contamination, specifically that compound. So that would be exported to, say, the manufacturing companies. They would use that as a chemical to add in the tablet. which would mean that the whole tablet would be contaminated.
Oh, okay.
So that's why the recall was there.
And then I also saw something with cigarettes.
Cigarettes.
I saw someone with a cigarette pair that was saying this one is for this market and this one for Marlboro had something I saw.
No, that's a different issue. That's not recalls actually, but that's more with, how would I say it, selling illegal non-branded Marlboros, for example.
So it wasn't the real stuff?
What they usually do, it could be the real stuff. Sometimes we find that. We get a lot of complaints from the official importers here, either liquors, hard liquors, cigarettes, where cigarettes and liquor end up in St. Martin, actually with a batch produced by the same manufacturer, but they get it somewhere else, maybe from another region, and transport it all the way to St. Martin, while the official importer gets it maybe from the States or Europe or wherever. But he is not protected, as a matter of fact. The manufacturer can't prohibit, for example, a local seller here to import it from another region. The problem arises when the people that bring stuff in that's not from the official importer cannot trace back things if there is a recall.
Okay.
For example, let me give you, if we have Johnny Walker here, we know we have an official importer. If there's anything with Johnny Walker, we can contact the official importer. He will deal with the manufacturer and we get all the information we need. The one who is importing it illegal, we don't know how to handle it. He doesn't have his contact. He's just buying a container somewhere, imports it and just sells it. And that's the problem. When you have recalls, it becomes an issue with this type of parallel import.
And that's quite prevalent in St. Martin.
Yes.
So it makes your job more difficult.
Quite challenging.
Do you have a lot of people working with you?
The food safety department, which is in charge of the consumables, including liquors and those things, I have 6 persons, 6 inspectors working there now.
I'm sure you're going to need more.
I could use more, of course.
You know, a lot of people sometimes even complain to me that they go to the supermarket and they see these items
expired.
Not expired, coming to that one, but this is Chinese language or Arabic and so forth, and they're saying, well, what's going on there? Is it okay to sell those products?
No, there's a labeling law here also, which is, applies to all products that come in. That, for example, one of the things that is needed is that a product must at least have a language that is spoken here. The official, one of the 2 official languages, Dutch or English. Preferably English. Most people here speak English. So English is actually mandatory to have it on your label. And of course, there are other requirements for a label, like production date, expiry date, you name it.
Right.
Content of the product. So if somebody is bringing things in, for example, from China or India, and it's only in Chinese or in Indian language, we have a problem, and we can act upon them. But what you see is, for example, people buy stuff on the French side with only French on the labels. It's a good product. We have Heineken with French labels here on the Dutch side. The problem is St. Martin has open borders, actually. So it's very difficult to control the borders. And my colleagues from the customs, they're doing a great job, but the only problem is that they're not interested in these goods, basically.
Okay.
They're looking more after weapons, drugs, these things. And because everything can be imported here, it becomes chaos.
But I think the food from the French side is not that. For example, I love to drink Coca-Cola, and to me, the one that I buy in the French side tastes better than the one I buy in the Dutch side. It might be psychological, but I don't know.
No, I mean, if you go there and you buy, that's your own risk, and you use it privately. You use it at home. You don't. But you may find in stores, for example, when Carrefour opened. We went there and we told them, listen, it's good, everything is properly, but you will need to have, at least next to French, you would have to have English or Dutch on your labels. Even your Carrefour products.
I noticed some of them had Dutch.
Yeah, yeah.
Yeah. Yeah.
Yeah. We spoke with them.
Yeah.
We addressed the situation.
So,
So it's difficult. You will have those small stores, the small Chinese stores, small Chinese markets, where they will bring in stuff from China and it's all Chinese.
yeah.
But if you go to the bigger stores, like for example Sony Food, Afood, that used to sell a lot of Chinese products too, you will find most of the packaging that they have with English text on it.
Okay.
But once we see those things, we also need to enforce the labeling law. That's correct.
What about, now the expiration date on food items is quite prevalent, I noticed in St. Martin.
There's a difference. You have a best before date,
Yeah.
which means that at that date, the product might not be in the best state anymore, but not that it's non-consumable.
Okay.
So you have the best by date, and then you have the not to be used after such and such date. So there's a slight difference there.
And that's there on the product?
It's also on the product, yes.
Okay.
Not to use after.
Oh,
you will see
okay.
that on the product. And you will see BB, best before date, BBD.
Oh, okay.
Okay, that means probably it would be best before that date, but that doesn't mean that you cannot use it, for example, within a month, 2 months after that date, if you keep it
Yeah.
properly stored.
But like what I notice sometimes, you go to the supermarket and you purchase something and you get home and you notice that the date already expired a week or two ago. You take it back. They don't make any fuss. They take it. But then you go back and see it back on the shelf again. That I think is...
We know that it happens. And we are basically addressing the situation now by educating the supermarket owners, staff in the supermarkets, by organizing a course very soon for them,
Yeah.
where we will explain them what this means and how they have to carry out controls on the shelves. Because sometimes nobody supervises it; they just want a quick turnover. But what is more important for us is that customers, we go to the supermarkets or stores, wherever they go, and they see those things, don't go on Facebook and put it out there. Call us or send us an email or whatever, and we will address the situation, because we need to know. What you often see is that people go on Facebook, put all kind of fancy pictures, and create a whole fuss around the stuff,
Yeah.
and sometimes even give the store a bad reputation while it's not true.
Yeah. So it could
And
be...
it could be
just
done on
oversight,
purpose
yeah.
too, sometimes.
Yeah.
We have had pictures on Facebook circulating with larvae and meat, or they put pictures with green meat. We had something recently too. We investigate those type of cases always. We had something too where they said that there was plastic in rice, a major brand. You have to be very careful with those things and investigate it properly, because those are big companies that
Exactly.
don't want to see their name tarnished like that. So if you circulate something in the media, you have to be sure, and you have to be sure that if you investigate it, that you also investigate it according to established methods.
And I guess what you will see is that's not done via the traditional media, it's done via social media, and that's the danger of social media.
Yeah. Now, people tend to ventilate before verifying. If you see something, report it, we will investigate and publish something if necessary.
The bad thing about social media is everybody knows a reporter. So,
and it goes very quick. It's, before you know it, something becomes viral.
Exactly. But you're getting problems with meat still, because I know I go to shop in the supermarket and I see the meat looks really nice. It looks great. Should there be any concern
on meat products here now? Not really. All the supermarkets that are now open currently are under our supervision. The part where they pack meat, where they process meat, we're there on a regular basis. Almost weekly we visit those places. And we also make sure that the staff working there went through a special course with regard to hygiene.
Oh, okay.
Yeah.
Everything is done.
It's actually, they're considered food handlers too for us. So they have to do the course, the training.
Do they also have to get the medical examination, etc.?
Well, there's no medical examination anymore.
Oh, okay.
They have to go through the course, which is actually educating them to process whatever they're doing there in a hygienic manner. Hand washing is very important. If you go to the toilet, etc., so wash your hands again as much as possible. Wear a glove if necessary. Wear a cap on your head. Those type of things.
Is there any reason why you'll discontinue the medical testing?
Let me put it this way. Research has shown that actually what you're referring to is the rectal examination and sending a stick which you swipe the rectum to the lab and checking if there's bacteria or worms or whatever in the stools. Research has shown that it is not more effective than educating them.
Okay.
So I remember the time in Curacao we used to pay almost $1 million. The public health service used to pay $1 million, and this was cost that government was making to check all those food handlers. $1 million a year. And you weren't seeing any difference. While when you educate the people and make them aware, for example, also of fresh vegetables that you need to wash them properly, hand hygiene, those are the important things. If you are cutting on a board, you need to make sure that the board is clean too. You cannot cut meat and then go cut vegetables on the same board, raw meat. Those type of things is what they learn in the course, which is very important.
All right, we have to go to a break. We'll come back and continue speaking with Dr. Bess, Inspector General Health here in St. Martin, and we'll also take your calls. Please stay with us.
Oh my, what an inventory list, and so unnecessary. But wait, your home contents are all insured by Be Sure. That means that you determine the amount you want to insure. No inventory list, no hassle.
Are you Be Sure? Be Sure.
Insure yourself fast and easy with Be Sure from the Windward Islands Bank Limited. Visit your preferred WIB branch, WIB Insurance Services, or BeSureStMartin.com. Get your Be Sure insurance at the Windward Islands Bank, your partners in progress.
Are you Be Sure? Be Sure.
At SXM, we're taking travel and tourism to new heights. Here we boast spacious check-in areas, 10 passport control points, comfortable departure lounges, and an exciting new airport mall. Finally, there's an airport in the Caribbean that takes your travel plans as seriously as you do. Princess Juliana International Airport.
Welcome back to Oral Gibbs Live. We're coming to you live here from World Star Studios at Amsterdam Shopping Center. My guest this evening is Dr. Bess. Dr. Bess is the Inspector General of Health here in St. Martin, and we're taking your calls at 54-221-70, 54-221-70. I have a question or comment for Dr. Bess. He's my guest in the program this evening. Doctor, there are a lot of restaurants in St. Martin. A lot of people go out to eat to fast food restaurants or other restaurants and so forth. Do you get any complaints from people about restaurants?
Yes. We had a recent complaint about the restaurant in Simpson Bay. I won't mention any name, but when we do get complaints, it's usually gastroenteritis complaints. They have eaten somewhere, and then within the next 10, 12 hours, they develop diarrhea or vomiting, and they can connect it back to where they have eaten. Now, most people don't call us. I must say it's a bit of an issue to reach us. We're not that easily reachable at the moment. But actually, you should report that so we can go and investigate the restaurant. Sometimes it's somebody who's ill or who carries bacteria with him. And due to insufficient hand hygiene, the bacteria end up in the food that they sell because the person is working in the kitchen. So these are all things that you need to investigate. And sometimes you even need to go investigating everybody who's been there and who becomes ill to trace back. We had something like this, I don't remember 2 years ago, that they had this huge student convention in Sonesta,
Yeah.
where suddenly a lot of them
Yes.
get ill.
Yeah.
Okay, so we investigated as a norovirus problem, but in preventing that, we changed the whole way the buffet is being set up. Normally, you would go and everybody in the queue would go and put the food on their own plate,
Yeah.
instead of having one person who at each station put the food on your plate.
Right.
So you get 1,000 hands touching everything all the time, which is not a desired situation. So this is something, for example, that you want to change. And educate them why you want to do it. Cover the food also. If
Yeah.
there's something.
It's quite strange because I don't like to eat at buffet unless I'm the first person to go to eat. I guess everybody know that now. But really, I don't like it because you don't know where people had their hand and everybody's passing, picking up the same.
Exactly.
It's not good. Or they're coughing and talking around the food.
Now, the best thing is to have serving staff, that put the food on your plate.
Exactly.
Yeah.
Much better. I want to jump back to medication because earlier you mentioned that there was one recall where a certain part of that medication was made in China, it was contaminated and it had to be recalled. Is there any restrictions on medication coming from China? Because a lot of people feel that China still carry a very negative name when it comes to.
Okay, we're going actually into the procedure of importing what we
Yeah.
call a drug, because not everything is considered by law as a pharmaceutical. A pharmaceutical is let's say a product
Yeah.
consisting of various chemical compounds that is used to cure or treat an illness. Okay, that's what we consider a pharmaceutical. Now, before a pharmaceutical can surface on your market, it has to be imported. When it's being imported, the importer has to register the pharmaceutical first, where all documentation is required on that specific pharmaceutical.
To your office?
Yes,
Okay.
that also happens. So any official pharmaceutical, which we also categorize as prescription only, for example, you have to go through a pharmacy to get it, has been registered. If there is, for example, let's say somebody is a cancer patient and it's a very special drug that is not registered but is needed, we can give exemptions for the product to come in. If it's not registered, it might be registered by the FDA or elsewhere already, but not in St. Martin yet. We can give an exemption to import it. Okay. So the whole regulation around import of pharmaceuticals, it's very strictly regulated. Now, you have another category of products that come in which are not considered pharmaceuticals and are free to import. Vitamins, for example, herbal things, those can come in free. We don't have control on that. If there are medical claims on certain products that are herbal, yes, then we will surely look into it. But once it's an official drug that you can only get through prescription, it has to be registered here.
So the key word there is prescription.
Prescription, let's say an official, what we call an official, a drug, a pharmaceutical, what's the law defines that. You will only get it prescription, that's prescription only.
Yeah.
Sometimes you can get it, how would I say, only in a pharmacy, that's another category, which might be, for example, the creams, antibiotic creams, what some people call over-the-counter drugs.
Yeah.
Some of them have been approved there for sale as only in the pharmacy, but not with prescription. But they still need to be registered.
Okay.
Okay? So you have different categories. But the main one, those that are prescription only for sure, have to go through a whole procedure, which usually is carried out by the importer, the official importer, of registering the drug. registering the drug, where they have to supply us with a whole box of documents of the compounds, side effects, everything needs to be there, all documentation on the product.
But you have doctors working with you at your...
No, we have a special committee.
Oh,
There's a
okay.
registration committee which go through the files for each product that is being registered. What we're looking now into, because of course it's quite
Oh.
a lot of work, so we're trying now to combine this registration process with Curaçao and Aruba. So we're not doing the same work for the same product on all the 3 islands.
Oh, okay.
So once something is registered in Curaçao and Aruba, we're saying, okay, it's been registered there. It's just a formality here.
When
We
it
want to even go further. We
Yeah.
want to even go further by also accepting, for example, registration from Holland and registration from the States and Canada.
That's good.
But that's the next step.
Yeah. So right now in St. Martin, any pharmacy can import drugs, or are there special, are there a few companies that can import drugs on the island?
No. We have about 6 or 7 wholesalers, importers in
Okay.
pharmaceutical preparations. So, pharmaceutical companies, representatives
Yeah.
of the bigger pharmaceutical companies on the island, or their branches from the main office in Curaçao and Aruba. They are residing on the island. Now, normally, under normal conditions, they would have to supply the pharmacies. If they cannot supply the pharmacy and the pharmacy is in need, the law also provides the possibility for the pharmacist to import directly from another source. And that can be registered or unregistered pharmaceuticals in St. Martin. And I have that weekly, on a weekly base. I have to sign off on import requests from pharmacies because the wholesalers cannot keep up the supply line.
Really? So there's, and then there's generic, and there's also...
Yeah, that's a, you have branding products, of course, and you have the generics. Yeah. But the generic market is not that big yet on the island.
Really?
We're moving towards that direction because of cost control. It's one of the measures to control your costs in healthcare, to lower one of the biggest cost drivers are pharmaceuticals.
It's quite interesting still when you look at the cost for medication, say, in St. Martin, and you go to the United States. Sometimes I have a problem in my eye, and I have to take a certain medication for the last, 5 years. And I purchased it in Puerto Rico. It was $158
Right.
for a little bottle.
Yes.
And when the Marigold, it was just $16.
Yes.
I just couldn't believe it.
That's the French system where you
Yeah.
purchase. Okay. The French system is more or less subsidized by the state for a big part. And it's part of the national healthcare system that pharmaceutical companies, they're producing actually for their system. So most of it is subsidized by the state.
It's cheaper there.
Yes. Yeah. And well, the state's business is business. But the system is set up in such a way that you have the manufacturer, you have the importer, and then the pharmacy. So you have markup in each step. And what you want to do is bring down the markup by introducing measures that can, achieve that.
And then you have the government taking the cost for a number of patients on the island to those that have PP cards and so forth, right?
Yes. Well, there's a certain group of drugs that are very expensive, in cancer treatment, for example, but also in HIV treatment. HIV treatment is one of the most expensive ones.
And those drugs you have coming into the island on a regular basis?
They're coming into the island, and they're not cheap because they keep developing the newest generation drug for HIV. And, in the past, for example, you need to take 4-6 pills a day, 3 times a day. Now it's only 1 pill, combining all the active substances in 1 pill, which you might need to take twice a day. But they are expensive.
And the thing is, we haven't spoken about that problem on this show for a while, and I wonder if we've seen a decrease or increase, because at one time there was some concern that in St. Martin there was an increase of HIV infected persons on the island.
Yeah, that data is available. I don't have it.
Yeah.
CPS is the one who collects data on the prevalence of disease here in the community. And to my knowledge, the increase, it's not like going this, it's more like a gradual slope now. It's not as explosive as it used to be.
Oh. You're also responsible for complaints that are lodged against doctors in the medical center. Is that part of your?
Yes, that's one of the biggest parts too. We are a law enforcement agency, meaning that we supervise the performance of doctors, the quality of the service they offer, but also institutions, healthcare institutions need to comply with providing quality of care, and also make sure that if there is something that goes wrong, that they report it to us. Healthcare institutions need to do that, but individual doctors also. So if a patient goes to a provider, a healthcare provider, they can complain about the provider or they can complain about the institution.
Do you get that?
Yes, very often. On an annual basis, but we do not investigate everything. We do the intake, and that's something I want to explain, because sometimes patients or clients think, hey, we go to the inspectorate because I want these people, I want to sue them. We have to investigate the case if we think yes, but most of the cases, the complaints we get have to do with communication between the provider and the patient, where things go wrong. But if it is something that we suspect that, hey, the treatment provided was not correct or mistakes were made or whatever, we will investigate the case completely. If it's more about communication, that the doctor didn't explain it, or patients find the doctor off, he didn't communicate properly, we usually mediate and send them back to the provider or the institution.
This is a very small island, and once you make a complaint like that, I wouldn't be going back if I'm that person. And you have very little alternative.
Yeah, but people have to understand too the workload when you're seeing a doctor. The man might be doing 50, 60 patients on a day.
Yeah.
You're just one of them. And that doesn't mean that he doesn't need to provide you proper care, but people get tired, so things can happen. Sometimes you get a patient, yes, they come up with a whole story, and afterwards it becomes clear that they didn't understand a word what the doctor has told them. And they fabricate their own story, for example. And then you bring them together and you check the file, you see that the doctor has told them everything. Sometimes it's just that they didn't understand, but they don't want to ask the doctor to repeat it. Or they are in denial too, they don't want to accept it. So there's a lot of angles when you investigate a case, You do the intake. I mean, some things are clear-cut things. I mean, things can go wrong.
Yeah.
And then you want to know why did it go wrong, not primarily for the patient, but also what can be improved.
Right.
What led to the wronggoing and what can be improved. Okay, so that's a matter of addressing quality. But we can take measures. So if we see that it is negligence from the side of a care provider, we can take measures against the care provider. We can take them to the disciplinary board, for example, individual care provider. And of course, the client can also go to court. If they say there's this gross negligence, and there's proof of that, you can go to court. We as the inspector can take you to the disciplinary board, the medical disciplinary board.
Has that happened in St. Martin?
Not in St. Martin yet. We do have a disciplinary board. But if we see that there's gross negligence and we take you there, it can lead to a couple of measures. Either a stern warning from the board, you can get suspended, or you can be, how would I say,
Reprimand.
prohibited for practicing.
Oh.
You can't practice anymore. That's the most severe one.
So, but at least you get patients that come and they complain at least, and you're in
yes,
this,
they come. They know how to find us.
Yeah.
It's a little bit difficult now because our office was destroyed due to Irma, and we're now in the vineyard and still trying to, relocate properly.
All right. Then we have to go to a break. We'll come right back. Right in Earl Gibbs Live. Please stay with us.
At Nagico, the things that matter to you matter to us. Like knowing you're fully covered after an accident, the security of your home and everything in it that means so much to you. And knowing that even when the weather does its worst, you and your family are covered. At Nagico, we're about much more than just insurance. We're about the big things and the small things that mean everything.
Why do you make me so long?
Welcome back. Welcome back to Earl Gibbs. I'm here to speak with Dr. Best. And Dr. Best, when it comes to eye specialists, we don't have any eye specialists on that Simrata. And when you're a patient from Simrata at that side, you need to go to eye doctor. You have to go to Marigot. And you have to wait long before you can see a doctor.
Yeah. Well, I can give you some good news in that regard.
Okay.
As you know, in the SMMC, we recently got urologists. We have one urologist now who is already fully booked, so a second is coming in very soon. And also, hopefully in September, we might be able to start up ophthalmology too on the Dutch side.
Wow.
Yes. It's going to be on a rotating basis like we're doing cardiology for a big deal now.
Yeah.
The second cardiologist comes on a rotational basis. The ophthalmology is also going to be provided by rotating ophthalmologists from Holland and a group from Suriname, from the academic center in Suriname.
Okay, so at least we won't have that problem anymore.
Hopefully not, and I can also tell you that the group is balanced in the sense that they can deal with any eye problem. So if it's retinal problem or cataract or glaucoma, they can deal with it. They have specialists for each area.
I was speaking with a doctor the other day. He was telling me that there are so many cases of cataract now in Simrata. It's unbelievable.
Yes, but cataract is considered under normal conditions and something of the elderly.
Yeah.
Because your lens deteriorates. That's a normal
So you can't do them to
process.
protect it during your lifetime.
No, you can't, because it's actually like a small glass crystal filled with liquid, and the liquid dries up. So with aging, the lens automatically becomes less flexible and dries out. So you can get cracks, it becomes not opaque. So with aging, it's normal that you get cataract. Not everybody gets it, but most elderly can get some problems. Then there is what we call a traumatic cataract. That means that you get something in your eyes, it damages the lens. Okay? Those are the two most common forms of cataract. And usually when people get cataract at a young age, it's usually traumatic, that something went into the eye.
Yeah, no, I had that through an accident years ago. Yeah. So doctor, wow, time going really fast. We're almost out of time.
I'll be back soon.
But I just want to say again, because I was able to see you operate after Hurricane Irma and the work that you put in to ensure that the people of Simrata really got good drinking water. And I just want to commend you for that, what you did with your staff, because we never saw anything like that in Simrata. Hurricane Irma was really devastating for this island. But you and your people did a great job.
Yes, we managed to get everybody on track, and even if they had their own problems at home, we managed to keep doing our job and do whatever was necessary. And one of the things, as you say, the first thing that we want to do is securing proper water, potable water, but also securing what we call the first line in healthcare, the GPs and the pharmacies, to get them up and running as quick as possible. Because the hospital was seeing a lot of GP cases there because they were all closed.
Oh.
So after a week or so, we got the GPs up and running. That is quite quick.
The general practitioners.
Yes,
and
the
so
general
forth, yeah.
practitioners, yes.
So you satisfied now the way things are?
Yes, the health sector, if you look at the health sector, we have almost a 95% recovery. There might be one pharmacy, two of the 14 pharmacies are still not operational.
How many pharmacies we had before?
We have 12 pharmacies, and two are still not operational.
Oh, okay.
The hospital is up and running. Actually, after Irma, the surgery theater was up and running. So we could continue at least care at a certain level.
Yeah.
You know, so I'm very happy how the health sector recovered pretty quick. That's one, if you talk about curative care. But also that we didn't get any complications like disease outbreak. You know, if you don't have potable water, you can get cholera, this kind of things. Compared to Lewis, it's a big difference, the aftermath. Lewis, we had the 10 camps. You know, you had the big shelters full with people, and you need to supply them every day with water. You had to make sure that they had sanitary stuff in the field there, that they could go to the toilet and shower, and you know, we didn't have that. And because Irma was also a dry hurricane, lucky for us.
Yeah.
Yeah. Could have been a very wet hurricane too, a lot of rain. We didn't get it. So in that regard, I'm pretty satisfied how things went, how we got the sector quite quick up and running again. Also the whole pharmaceutical supply chain. We've got a lot of medication coming in. You need to manage everything that's coming in through from all those donors,
Right.
you know, all the organizations that try to help you out. So there's a lot of work involved in this, but I'm happy how things went.
Well, again, I want to thank you for coming in, and thanks for doing such a great job and
Thank you.
continuing the great work. All right. That's it for now. See you next time right here on our Earl Gibbs Live. Until then, good night. Take care. Bye.